Okay.
Good evening. Yes, sir. Good evening, everyone. We would like to wholeheartedly welcome each one of you for the mental health webinar series 2020-2024. And this is on behalf of the Department of Psychology, the American College of Madurai, in association with the Yellow Pond Counseling Center, Pallikarna, Chennai, and the Deccan Positive Mental Health Practitioners Association. Today, we have reached session number 1504 and our Honorable Resource Person, Dr. Venugopal Reddiar, sir, will be speaking on the topic, a dose of humor. And regarding an introduction to sir, he has an MBBS, an MD, MRCP, ABIM, that is from the American Board of Internal Medicine, United Kingdom and USA. Academic qualifications are MBBS, MD, MRCP, ABIM, American Board of Internal Medicine from India, United Kingdom and USA. Professional experience, he has been practicing medicine for more than 45 years. He's been a trainer and teacher for more than 35 years. He has presented more than 100 webinars on more than 100 different topics on behavioral science. A very, very warm welcome to you once again, sir. The floor is yours. Over to you, sir. Thank you so much once again for being here. Sir.
Okay, good evening. Good evening, everybody. Let me start the slideshow. I assume the slide is visible and I am audible.
Yes, sir.
Dose of humor.
Sir.
Laughter is the best medicine. That's an English saying. In Vai vittu sirithal noi vittu pogum. That is a Tamil saying. And in Hindi, hasna sasiko badata hai. So humor. I'm going to start my session and I will try to finish my presentation within, say, 40 minutes. Then after that, in the 20 minutes, the audience, you can share some humorous incidents from your own life. Because here, I don't think that you need to ask any questions.
Light putta.
Okay. Sunitaji, please mute. Or Anitaji, mute the microphone of others. My dear friends, keep the microphone muted. Purpose of this discourse, tickle your funny bone. Stimulate the release of feel-good hormones. The feel-good hormones are dopamine, oxytocin, serotonin, endorphin. If you look at that one, that itself is DOSE, the acronym. This webinar is based on FEQT, facts. I'll be sharing facts about humor, laughter, and some scientific evidence that would substantiate the claim that laughter is the best medicine. Sunitaji, please mute the microphone of all the
Yes,
other.
I have sent a message, sir, to them.
No, you can.
Friends,
You can
please mute your mics and yes.
No, you can mute that one. If you go to the gallery view and
Yes,
if you
okay.
find that somebody
Done,
is,
sir.
that one is unmuted,
Done.
mute it. You can do it.
Yeah,
We
yeah.
have the control. Yeah.
I'm done, sir. You please go
Yeah.
ahead.
Okay. So then, experience. I'll be sharing few humorous incidents from my own personal life and professional life. For the information of the audience, I'm a stand-up comedian also. Mr. Ansari, he'll be able to testify that. I was the vice president of the Humor Club in Trivandrum from 2009 to 2015. I've done more than 70 stand-up comedy performances, and the Asianet, the TV channel, they telecast one of my comedy performance in 2011 or 2012. And all these performances in India and USA. Then quotations. Lastly, thoughts. Thinking is one of my favorite hobbies. So whenever I read a newspaper or whenever I hear a news, I think differently. I use the word, I think differently. I try to see humor inside that news. There are numerous books on humor. Just I'm going to display a few titles. Sense of humor. Humor that works. And humor therapy. My dear friends, in USA, therapeutic humor, they do give training, therapeutic humor for nurses and other health professionals. Definition of humor, the ability to be amused by something seen, heard, or thought about. Seen, heard, or thought about. Sometimes causing you to smile or laugh. Research shows that children laugh about 400 times a day, but adults on average laugh only about 15 times. Why? What happens? The children are all happy. And then the laughter, the number of times laugh. And I have seen some people, they never smile. One of my professors back home in the medical college in Trivandrum, we haven't seen him smiling at all. If you greet him, good morning, sir, good morning. Very serious expression. Actually, such people, they require the laughing gas, that is nitrous oxide, to make them laugh. Gandhi's own words, if I had no sense of humor, I would long ago have committed suicide. Are you aware of this quotation? If you are not aware of this quotation, in the chat box, put the alphabet N. Let us make it interactive through the chat box. This quote, Gandhi's quote. If you are not aware, put N. N. Jyoti Mukherjee, N. Maheshwari, N. Okay, good. Thank you. Because I want to know whether I am sharing some information which is new for you. So Gandhi also, the father of the nation also, was aware of the power of humor. Otherwise, he said that he would have committed suicide. Because fighting against that freedom fight, very stressful. How many years? After coming back to India from South Africa, nearly, I think that 25 or 30 years is not a short period. Frustration, anger, irritation. I think that he was able to cope with all those negative emotions using his sense of humor. William James is a psychologist. A sense of humor is just a common sense dancing. I'll repeat. People with a rich sense of or rich common sense, they will have sense of humor. Common sense is absolutely required to have a sense of humor. You may not be able to change a situation, but with humor, you can change your attitude about it. If you agree with that quote, in the chat box, put A. Do you agree with that quote? In the chat box, put A. Yes, Jyoti Mukherjee. Yes, Manjulaji, Kiranji. Because I used to face a lot of stressful situations at work. And on those occasions, sometimes I used to feel initially frustrated or irritated. Then I immediately used to change that one, everything. I used to look at it from a humor point of view. The moment I used to see it from a humor point of view, the negative emotion immediately vanishes. Laughter and anger, they cannot coexist. Fear and humor, laughter also cannot coexist. So the best antidote against fear, anger, or even anxiety, depression, laughter. Not the laughter yoga. My dear friends, I want to repeat this. Laughter yoga is not coming from inside. You stand there, ha 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 ha, ha 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 ha. There won't be any secretion of the happiness hormones. That is emotion. This is mechanical. Some people may disagree. That's fine. But that is my opinion based on somebody else has unmuted. And there is some kind of a quarrel or fight going on in that place. Okay. Real life humorous incidents. I'm going to share few real life humorous incidents. Pass out. What does it mean? In the chat box put. You must have used that expression, pass out. What does it mean? Let me see. What does it mean? Haven't you used that expression, pass out? What happened? Suddenly, no response, feeling burned out. Okay. Thank you, Anitaji. Anybody else? Usually, they say, I passed out in that examination. I passed out in 19, feeling low. Passed out in medical college in 1974. Passed out. There's a passing out parade also. In Trivandrum, passing out parade. So what happened was, when I came for the interview in 1994, and the program director, he asked me to just describe, okay, doctor, tell me about your education and your experience. Yes, clear exams, Jyoti Mukherjee. So then I told, I went to a medical school in 1969 and I passed out 1974. Then Jack Ebright, that's the name of that director, he asked, what happened? And I got confused. And I repeated, I passed out. Then Jack Ebright again repeated the same question. Why? Why? He's asking why. Yeah, I cleared the examination. He's asking why. Then I explained it saying that I took my exams and I passed out. And he said, oh, you mean you graduated? That time I haven't heard this expression, graduated. I nodded, yes. Then I joined there in the outpatient clinic. A patient came and I said, what can I do for you? The patient said that I'm having fever for the past 3 days. And yesterday I had headache and then I passed out. I thought, what? So after the headache, he passed out? What did he mean? So I went to the next room. I asked him to wait. into the next room and asked the nurse, the white woman, what does the expression pass out mean? She told me that is, you lose consciousness. Yes, Maladi ji. You lose consciousness. So in USA, if somebody says that passed out, that means you faint. You lose consciousness. Okay, so now I realize that is why that Jack Ebright, he was asking me, when I told him in 1974, I passed out, he was wondering that, what happened? So that is one incident. Do you find this real life incident funny? If you find it funny, put why in the chat box. Because I want to make sure whether I am the only person who is feeling funny about that one or others also. Yes, Jyoti Makardi, thank you. So that is a real incident. So always the language, some of this one incidents based on misunderstanding. That is communication. That one creates many funny situations. Scheme. We here in India, before I went there, State Bank of India, they have new schemes. Canara Bank, they have new schemes like that. So after coming here, after opening an account in a bank, a couple of months later, I went there and I asked that bank manager, do you have any new schemes? Manager told me, what? Do you have any new schemes? No. We do what you call, yes, Maladi Arsuji. We are honest. We don't cheat anybody. We don't have any schemes. I said, in India, the banks, they come out with many schemes. Really? That is new information for me. No schemes. Then I asked one of my colleagues, in India, the banks, they have schemes. Here, the bank manager says that there is no scheme. And it's that in USA, scheme means cheating, fraud. So he is a schemer. It's a new scheme of how to cheat people. So that is why the manager immediately told me, no, we are doing honest business. Nothing, no scheming. So that is the second incident. Slim chance. Obviously, after coming here, I wanted to buy a car. And I was on the stipend. There's not a lot of money. So I wanted to, yes, Maladi, low probability. So I wanted to buy a Honda car. I didn't want to buy a small car. I didn't want to buy an American car, which was available for $10,000 to $15,000. This one was available around $18,000 to $19,000. So I went to the credit union to get loan. And they told me, okay, you have to put a down payment of, say, $3,000, then you can monthly payment this one. I told them, see, I don't have any money to down payment. Now, is it possible for me to get this one? What are the chances of getting a loan without putting down payment? And she told me, slim chance. Okay. So I thought, okay, I will try in some other credit union. A slim chance, the word itself is slim. So I understood, literally, there's a low possibility. I went to another credit union. There again, I repeated the same. And she told me, oh, it will be hard. That is, if you don't put the down payment. I asked her the same question. What are the chances of getting that loan? Fat chance. And I felt excited. Okay, could you please give me the form? She repeated, I told you, it's a fat chance. Then I got confused. Yeah, you told me fat chance. That's why I want to apply. Then she repeated and said that fat chance means no chance. So slim chance is some chance, low probability. Fat chance means no chance. But the word slim and fat, totally opposite. Do you find this funny? If you find this funny, put in the chat box why. So the language, English language, it is at times very, very confusing, and the very same word can have a different meaning and interpretation. So that is what happened. Thank you, Deviji. Then that is the third incident. Fourth, lift. In India, we use the word lift on different occasions for different situations. After a few months, after coming here, my car broke down. So I had to leave it in a garage. And I went to work. In the evening, I had to go and pick up the car. So I asked the white guy, friend, and said, hey, Charles, and could you please give me a lift? Why do you want me to lift you? I said, no, not lift me. I said, I want a lift. Then again, what? Why do you want a lift? And I told him, my car broke down this morning and I've left it in a garage. So I want to go and pick up the car. Then he said, oh, you want a ride. So in America, if you want somebody to give you this one to go, then you have to say ride, not lift. That also I learned. Many things I learned by using our typical Indian expression. It is different. That is a humorous incident. Then jaywalking. Do you know what jaywalking is? If you don't know, put yen in the chat box. Jaywalking. No. Marji, no. Jyoti Vakari, no. Okay. This is also another incident. That is after joining here. Maladiji, I think you are right. And the Gora guy who was sitting next to me. And he told, during the lunch break, yesterday I got a ticket for jaywalking. You know the expression ticket. In India, ticket is something good. You buy a ticket. So he got a ticket for jaywalking. So then I asked him, hey, I would like to get a ticket for jaywalking. So how do I get it? What? Why do you want a ticket for jaywalking? What is jaywalking and what is the ticket? Jaywalking means if you cross a road where you should not be crossing by walking, then that is an offense. Ticket is a penalty. The police will give you a ticket, means it's a fine. So jaywalking is the designated area and you cross somewhere else. That is in India, we walk anywhere. Yeah, if you want to cross a road. So that's a fine. So that is jaywalking. So that is what, and I said that I want a ticket for jaywalking. He found it funny. That's again another humorous experience. Encounter. Okay. Again, in India, encounter. Yogi Adityanath, the government, they killed 183 criminals. Police encounter. And that is encounter in Tamil movies also. Encounter la pottu thalirnu. Encounter la. And here also when I came, and my supervisor came. Dr. Reddiar, to make sure that is your encounter, that one is not complete. And what is encounter? What is encounter? That is when you see a patient here, that is called encounter. Seeing a patient is an encounter. So you have to complete that encounter form. There's a form. It is not again written encounter, but that form you complete, that is called you have seen that patient or how many patients you saw. That is encounter. So initially I thought that you must do encounter. I thought, what? He's asking me to shoot the patient? Encounter? Then I realized encounter means that is a visit patient's meeting. GOK. This happened when I was in the medical school in Trivandrum. The dermatology, the professor, the students were standing behind him. And he writes the symptoms, patient says this symptom, that symptom, everything he examines. And sometimes for some patients, he used to put GOK. And at that time I was a third-year student. And I asked the friends also, എന്താണ് GOK എന്താണ് അറിഞ്ഞൂടാ? And then they didn't dare to ask the professor. But I asked him. Somebody has unmuted. Somebody has unmuted. Please mute that one. That's Surega. Okay. Then I hesitated and asked him, sir, what is this GOK? You don't know? I don't know. God only knows. Yes, some patients, when they present all the symptoms, I don't know. What is the diagnosis? So that is why I put GOK and I manage symptomatically. I give medicines to take care of his symptoms. If he's having itching, then I'll give him an antihistamine to take care of that one. If that skin is rough, something like that, I'll give some cream, steroid cream to make it smooth. That is that GOK. Even now, my dear friends, I've been practicing medicine for nearly 50 years. I started my career in 1974. Some 4 or 5 patients, we don't make any diagnosis. It's not easy. Undiagnosed. Dry out. Do you know what this dry out means? If you don't put N in the chat box. If you don't put N in the chat box. No. Okay. Manjulaji, okay. Now, Maladi Arasuji, she is the smartest person so far I have seen. Maladi ji, do you know what this dry out means? Okay. Okay. So, and desiccate. That's a literal meaning. All these STIs in the emergency room. I was in the emergency room. Here they use the expression urgent care, not casualty. And a patient came in the evening and typical, what can I do for you? I want to dry out. You want to dry out? Then I was looking at his hand, whether he's carrying something wet, something so that he wants it to be dried out. What exactly? You want to dry out? He said, yes. Then I went to a nurse. Now, sir, what does the expression dry out mean? That means he wants to stop drinking. He wants to stop drinking, quit drinking. So that is what the expression dry out means. Then I went and said, oh, okay, we can help you. So we can help you dry out. Okay, we can help you dry out. Metrogyl. This is antibacterial medicine. And this is one thing, it is for the ladies with the infection in the vagina, bacterial infection. They give the metrogel or flagell vaginal tablets. It came in the market some 40 or 50 years back. And at that time, the gynecology department, the doctor prescribed flagell 20 tablets. And the patient was a poor woman, an illiterate woman, and she rushed through. It was very busy. You had to see at least some 20 patients in an hour. So she prescribed that one, and there was some she didn't give clear instructions. So 20 days later, the patient came back. ഒരു കുറവില്ല പിന്നെ ആ ഗുളിക കഴിച്ചിട്ട് after taking the tablet I'm having lot of the chest pain, irritation. The doctor was and she examined her vagina. No relief. It is worse. Then she asked, those who are gulia, every day did you put that tablet inside your vagina? She said, no. Then what did you do? Every day I swallowed. So that again, communication failure. This also happens very often, especially in the medical field. Communication failure is the mother of all failures. Anacin. I don't know how many of you heard this name. It is no longer available, I think. Anacin, if you have heard, put in the chat box why. Anacin. Yes. Vinita ji, yes. Yes. Anacin is a painkiller. Interesting incident is the pharmacology examination, pharmacy examination. The tutor was standing behind the examination. The examiner asked the question to the examinee student. Okay, tell me the name of a broad spectrum antibiotic. Broad spectrum antibiotic. That means antibiotics, some antibiotics, they are good for gram-positive infection. Some are for gram-negative infection. But penicillin is for the gram-positive infection. Penicillin doesn't work well with the gram-negative. But broad-spectrum antibiotic, it will take care of gram-positive as well as gram-negative. And this boy, he was not sure what is a broad-spectrum antibiotic. At that time, the tutor was standing behind the examiners. He wanted to help him. He tried to communicate so that he will give the right answer. Do you know what he told? Anacin. What happened? Why? What did he mean? And why this boy told Anacin? Because at that time, Anacin was a very popular painkiller. This was the advertisement. Anacin acts in 4 ways, 4 different mechanisms. So that gesture, the boy immediately thought Anacin is the right answer. Do you find it funny? If you find it funny, put F funny so that I will know whether you find it amusing. Very funny, Binidaji. Thank you. Yes. So that happened. These are all real life incidents. Jyoti Makarji, thank you. Serious Viagra effects. I have put that number 4, priapism. Sudden vision loss and everything. Number 4 is priapism. In USA, not like in India, Every prescription medicine, the pharmacist, they give a handout about the side effects also, a printed handout, so that the patient will be aware of the side effects also, to protect from the legal, some kind of a malpractice suit. One old guy, an 80-year-old man, one of my patients, he had erectile dysfunction. That is, he was not able to get erection. And he asked me to give Viagra. The patients here are not like in India. They come, they are not very much inhibited. They tell, okay, I'm having this one, I would like to get Viagra. At that time, Viagra was advertised in the TV channels, everything. So I prescribed Viagra. And 3 months later, when he came back, and I asked him, okay, did you try the Viagra? And did it help you? Oh, no. I didn't. I'm really scared. He said, what, why? What do you mean by you are scared? Hey, it was saying something like that. He couldn't pronounce the word correctly. Some Priya, something like that. I said, okay, priapism, okay. Then what happened? Hey, I checked that one. That means can cause persistent erection and painful. Because one of the side effects of Viagra is it can sometimes cause an erection, and that will be painful, and it will last for many hours. Then you will have to go to the emergency room, and you may need sometimes a surgical intervention. So this guy told me, I don't want to go to any emergency room with a painful erection, and that'll be embarrassing for my family. So that is another situation. And another patient who was getting the Viagra, and the maximum dose of 100 milligram, and he was getting erection. And the erection used to last for maybe 5 minutes or something like that. He came and asked me, Doc, it lasts only for 5 minutes. I'm thinking of taking 2 tablets. That is overdose. And I asked him, Mr. Harrison, if you have a sense of humor, then I want to say something. Do you have a sense of humor? Yes. This Viagra overdose sometimes causes sudden death. People do die, just like that. So unfortunately, it happens, then they will find it difficult to close your casket. They will find it difficult to close your casket. Then he immediately burst out laughter. I get it. Did you get it, my dear friends? Did you get this joke? And I told him the casket is, if he's dead, that closing that one, because he may have I put a joke, he may have a persistent erection, and they may not be able to close the lid. But I make sure that they have a sense of humor. Otherwise, they may get angry. They may feel offended. You don't know how many truly crazy people there are in the world until you have worked in the medical field. This one, truth is stranger than fiction. You may find it difficult to believe this happened. If people, when they come with sore throat, my dear friends, please, medical advice. This is my medical advice. More than 95% incidents of sore throat or cough, they are not caused by bacterial infection. They are caused by virus infection, and you don't need an antibiotic. But unfortunately, many doctors, they unnecessarily prescribe antibiotics. I don't. I usually examine the sore throat, and I tell them, no, take warm saline gargle, sore throat, that is warm salt water gargle 2 or 3 times, and then don't eat or drink anything that is cold. So when I told the patient, and he was asking, can I eat ice cream? I told him, don't eat or drink anything cold. And his question is, can I eat ice cream? Then I put it in a slightly sarcastic way. If it is hot, yes. So what kind of a question is? You get it? So that is what. There are many incidents, and for want of time, I'm not going to get into those things. Every day newspaper, when I read, I look for humor. Here's one Louisiana man sentenced to over 200 years in prison for child sex crimes. 200 years? He is already 35 years old. Who lives for up to 235 years? Ridiculous. Stupidity. Then I used my sense of humor. Okay. In Hindu mythology, yeah, we have reincarnation, rebirth. So that means he goes, he dies, then when he is reborn, again he'll have to complete that sentence. And at least 2 times rebirth again to complete that 200 years of imprisonment. That is how I find humor in any news. Every day I read the newspapers and I try to find some humor inside that one. Pigeon suspected of being Chinese spy cleared by Indian police. They caught a pigeon. It was detained for 8 months detention. 8 months that pigeon was detained. What kind of interrogation? Did the CBI or NIA ask the questions and the pigeon refused to cooperate and give the password? All those things, just like what Kejriwal is doing. Pigeon detained for 8 months. Can you believe that one? This is a real incident. Good news, you can make your fecal transplants orally. What are those pills? What are those pills? Anybody? The answer, respond that one. If you don't know, say no. N. Put N if you don't know. Okay, no. Shabnam Rana, okay. No. Those pills are human feces. Slang word, shit. Those are all shit capsules. And there's an infection called Clostridium difficile. Every year, nearly 14,000 people, they die. 250,000 people get admitted. Eventually, they found out how to treat. That is a healthy donor. The stools from that healthy donor, then they mix with the saline and all those things. They blender, they prepare, and they used to administer through the colonoscopy, through the rectum. It works. It works. Now they have come with a oral pill. Very same shit. They powdered, dried and powdered, and put in the capsule. You take that capsule. So what are you eating? If you ask somebody, hey, what is that capsule? It is shit. It is shit. It is a medical therapy, treatment. So those are the ones, capsules. Poop pills. Again, Rahul Gandhi news, humor. Rahul Gandhi wins hearts, drives tractors, sows seeds. Look at that one. He is in the farm field. He is driving a tractor. Again, doing that one, sowing seeds, tractor. There is a rental car company. Their slogan is, we try harder. And Rahul Gandhi wears the railway station and coolie, and he is carrying a luggage which has got the wheels. You don't need to carry it on your head. You don't need to carry it on your head. Is it not funny? So trying hard to some or other win the hearts of the people, doing all these things. So Rahul Gandhi, every day, first thing I do, Google News, I put Rahul Gandhi news. Yeah, it has wheels, Vinitaji. Okay? And every day he says something or does something, that one is, for me, it is humorous. I'm not against any particular person or any particular political party. Rajiv Gandhi was a person with a very charisma, and he had rich sense of humor also. And Modi has got rich sense of humor. And Rahul Gandhi, whatever he does, whatever he says, that one is gives me a good dose of humor. Therapeutic benefits of laughter: reduces stress hormones, cortisol and adrenaline, boosts immunoglobulin A. This is a immunoglobulin secreted in the saliva and all those things. That immunoglobulin A level, if it goes up, you won't get frequent infections, no sore throat, no pharyngitis, no laryngitis, no upper respiratory infection, no sinusitis. So laughter, yes, protective. I have, the last time I took an antibiotic, maybe some more than 10 or 15 years back. I don't get any of these infections because every day I laugh a lot. Relieves anxiety and depression. Upcoming talks, every week I give a talk, and this Thursday, why is life unfair? Realistic mindset. That is the Zoom link. It is the same every Thursday. You are all welcome. Now, my talk is over. I'm giving you just 3 seconds for you to take a screenshot or write down that number. And I will be sharing the PPT Jyoti Mukherjee of this session. And you can get that one. As soon as the talk is over, I will share that PPT with Sunanda ji and Salim ji. Now, instead of, now this is open, now you can share your own experience in life. Some interesting, amusing experience. We have another easily 10 minutes. Go ahead.
Sir,
Thank
can
you
I
so much
talk?
sir, for a
Sorry.
wonderful session. And friends, if you want to interact with sir and share some of your experiences, you may do so. Yes, ma'am. Yes, ma'am.
And please
Can
turn
I
on
share
your
one
camera.
thing?
If possible, please
Yes,
turn on
sure.
your camera so that a humor, just not the voice, audio. Yes.
Can I share, sir?
Yeah. First, Manjula ji. Okay, then Jyoti ji. Okay, Manjula ji.
Yeah. It was so funny, sir, your talk. And it reminded me of my parents. Okay. My mother and father used to go to this Laurel and Hardy pictures. And my father, even now when I remember him, he had a hearty laugh. So I don't know, my mother knows English and all that. And he used to laugh and the whole theater will be laughing. And when it subsides, I believe she'll ask my father, what was so funny that, that you and the whole theater had to laugh? So it reminded me of them, sir. Thank you so much. That was really great. Thank you, sir.
You're welcome. That is, some people have no sense of humor. Believe me, it'll be very hard to make them laugh. They will try to analyze. They will try to use logic. The humor cannot be. If you use logic, you won't laugh. Okay? If you have got a strong, a logical mind, you won't enjoy the humor. The cartoons, I watch the political cartoons. And every day I end up laughing. When I laugh, I mean belly laugh, not just a smile. No, belly laugh. That is when, that is an internal jogging. The laughter is something like that, internal jogging. Belly laugh. And at work also, my nurses, they used to come to me, Dr. Reddiar, say, why don't you crack a couple of jokes? Because we are feeling stressed. Okay? So I used to entertain them with some jokes. And here I use just like the political figures, like at that time, if it is Obama or if it is Trump, whoever it is, I use the jokes based on the news. Okay, Jyoti ji.
Sir, I have one question and one experience. My question is that can we add humor to the talk while dealing with difficult people who are very inquisitive and could be anyone who just cross the boundaries? Like I always used to question Almighty how to deal with these people. So I think humor is the right way to deal with these people. So that's what I'm questioning.
Now give me a specific incident, then I will give you the suggestion. Because crossing the boundary, for some people, what exactly do you mean by the crossing the boundary? Give me a specific scenario.
Scenario is like, scenario is my neighborhood. Some people, they want to, now they don't interfere much. But there was a time when I had passed out from my dental college and I was seeking for a job. That time they used to question me a lot. That where you go, what you do, and all.
You also passed out.
You also passed out. Yeah, she passed out.
That time
you got it.
struggling.
Yeah.
I was struggling to get a job, And that time they used to question too much. And it used to irritate me because I cannot explain myself to everyone that
So
I'm going
it
here
is very
to
easy,
apply for a
very
job.
simple, very simple. That is it. Okay, why don't you start a dental clinic? I'll be glad to work for you. Start open a dental clinic for me. Then they'll stop bugging you. Okay?
Okay.
Yeah.
And
Why don't you
one
start it? Yeah, dental clinic so that I'll work for you. Yes, I understand that you have got a lot of concern about me, and I'll really appreciate. Start a
And
dental.
one of my experience I would like to share out here. It
Mhm.
was like I was migrated to a new dental college after a long years of gap, and that was all mercy of the great good God. And my pharmacology teacher, it was just 1 month before the exam, I was migrated to the new college with a long pause. So my pharmacology teacher, he was teaching me, and he told me, go get tell some these ward boy to get a water glass of water for me. So I came outside and I was looking here and there, and I saw a very dark complexioned long fellow. He was wearing shorts. So I just मतलब कि गलती लग गई. And I asked him that आप वो पानी पिलाने वाले भैया हो ना, अंदर वो सर ना वो पानी मांग रहे हैं, pharmacology के teacher. He's asking for water, and he says, no, I'm a prosthodontist, I'm MDS prosthodontist. And when I heard this, I was, oh, sorry sir, I didn't know you're a prosthodontist. Like I just then I went and told to my, I felt funny, and I went and told to pharmacology teacher, sir, मुझसे गलती हो गई. There was a prosthodontist standing outside, and I mistook him as a ward boy, and he was dressed up in shorts. So and was dark complexion. Then he said, this is a very big mistake you made. He is the most highly paid teacher out here. He is from south. So he dresses up like that. And then he took me to him, and he says, please forgive her, she's a new student in this college and she doesn't know anything about the college. So he says she must know. And then we apologize to him.
Okay, now that is actually, it is not your fault. It is not your fault because you must dress according to your that one profession. There is a dress code. You are expected to dress that way. It is okay for me to wear some jeans or some shorts or something like that, even jeans with torn jeans and all those things somewhere else. But if I go to a hospital, the patients, they don't expect me to. They expect me to wear differently. That is why it is his fault. You should not have even apologized. To be frank, the other case is that it is high time that you have changed your dress so that people, the students won't mistake you for a ward boy. That should be the message. So don't be apologetic. Okay, Ansari ji.
My father was working railways. I was a station master. And what happened one day on ops crossed the track, and the train hit that one. That because of that one, half a minute late. So at that day it was very strict. So the next station, the driver came and he himself has to write the report, and the station master has to write. So he told that one then he don't know the word, only half a minute is there. So he wrote, a cow's husband crossed the track, so the train was late by half a minute, because he has to hand over and run away to the railway track. And another
Okay,
thing
so-
is that
So it
one
was a bull.
doctor-
So the bull crossed the railway track. He didn't know how to write it. So he put a cow's husband.
He don't
Okay.
know cow's husband. And another one is on doctor. Because of this doctor's mistake, what happens? He was having immense pain and he was bedridden. Some operation problem was there. So he was within 2-3 days he will die. At that time he called his wife and told, see, come here. You should be. See, I have a last wish. That is, I am going to tell you that you should do that one. Then she told, what you tell me, okay, I will do it. Then he told, after when I die, you should marry that doctor. Then he asked, why that fellow? Because of that fellow only, I was suffering for the last 1 year, and you are telling that you should marry. Because I suffered for last 30 years with you, so you should also suffer for some years, like that.
Okay.
Thank you.
Okay, thank you.
Thank
And
you.
when you said that the cow's
Yeah.
husband, a long time back, this happened almost 50 years back. One of my friends, he went to Bombay. At that time, he didn't know how to speak Hindi well. He went to Bombay and he went to a restaurant, and he wanted the chicken, and he didn't know that Hindi, murgi or murga, or whatever it is. And the waiter asked, "Kya chahiye aapko?" Then he looked around, and there was another guy who was eating egg, a boiled egg, and he said that, "Uska ma, uska ma, uska ma chahiye." Okay, that means I want the mother of that egg. So for the chicken, he said uska ma, like that the cow's husband. Okay, Shabnam ji.
Good evening, sir. That is a real good one. I also have this incident. We went Kerala once, and there was this guide who was wanting us to see some local goats. So no, ha, ha. So he didn't know the word. So what he said was, "Look, madam, mutton crossing. Look, madam, mutton crossing." So, so that is one incident. Another incident, an army officer, newly recruit. So he's giving instructions to those jawans, and he's telling them कि कल सुबह हम operation पे जाएगा and सब light खाना रात को खाएगा. नहीं, खाना नहीं, light खाएगा. So he's one of
You are not audible, Shabnam ji, right now. And then look at this one. How many people attended this session? Yeah, how many people attended this session? Just less than 40. People don't want to laugh. They don't want to feel good. They want only serious topics.
Thank you.
Problem.
Thank you so
Yeah.
much.
Yeah. And when you said that one, my son,
Had a hearty
he came, I sent him to India. From the 8th grade onwards, he studied in Trivandrum, the international school. And so he was not very fluent with the Malayalam. And in the school, they wanted for some event
love.
to
Thank you,
bring
sir.
rice. So bring some rice. That is 2 kilo of rice. So he came home and he told our cook, "Chor venam naale 2 kilo chor venam." Because he didn't know the right Malayalam word for rice. And he know that chor, that is cooked that one rice. And the cook also made 2 kilos of that cooked rice in a big hand. And he said, "No, chor. And she said, "Yeah, chor. This is cooked rice." Then he went inside and took that rice. So that again, miscommunication because of the language, that one. Okay, now anybody else? And laugh, my dear friends, laugh. Laughter is the best medicine. If you want to enjoy good health, and by God's grace or any my healthy habits, I'm not taking any medications except vitamin D, because here you don't get enough sunlight. Only the vitamin D, and I don't fall sick. The last time I had a fever must have been more than some 10 or 15 years back. I don't even remember. And the COVID, I didn't take a COVID vaccine at all. I didn't. That is not because I'm against all vaccines. I'm in support of polio, triple everything. But right from the beginning, I was saying, using my medical knowledge, this vaccine won't prevent or protect anybody from that COVID infection. And my immunity, I laugh a lot and I eat healthy food. I didn't wear the mask also most of the time. No problem. So laugh, laugh, laugh. Find the humor in every situation. Okay, Kiranji.
Hello, sir. It was a wonderful session. So, am I audible?
Yeah.
So I also want to share one experience during my college days. It was art fest. So we were doing a drama. So so it was a competition also. So it was like a drama written by Priyanandan, a serious drama called named Samayam. So it was like we need to prepare like some special coat was there, which was one character is old character is lying on the coat. There was a clock. So it was lifted like that. So like metaphorically, it was so the situations were used. So I was playing a character of a watch mechanic. So what happened? A lot of dialogues were there. In middle of the drama, I forgot the dialogue. I was actually blank. So the communication. So I was totally blank. The entire college is there. I was like standing, like what to do. So after 30 seconds, my co-actor, what he did, he presented next dialogue. So I remembered, and we continued. We got first prize, and our Sanskrit teacher, he came to me. Kiran, it was an excellent drama. The characters' performance was, you have performed really well, especially the scene where you know that situation is the old man will die, eventually die. There is nothing can be done. So a lot of emptiness. How will you, the 30 seconds of the scene without dialogue, your eyes, that emptiness was visible. And your fingers were acting because I was shivering. So he said, that 30 seconds was an excellent performance. How did you manage to bring that emptiness into your eyes? So I told sir, method acting, we were rehearsing a lot. Actually, I was blank. I forgot the entire dialogue for a period of 30 seconds. So that's what one incident.
Because you know that the Sadhguru, if you have heard any of these talks of Sadhguru, he has got a rich sense of humor. And you must have seen any interview, he laughs. And the Swami Chinmayananda, very rich sense of humor. So humor, that is develop that sense and watch comedy movies or comedy video clippings. That's what I do. Tamil movie, the Tangavelu, then Nagesh, Vivek, Vadivelu, Malayalam, Jagadish Srikumar, Srinivasan, Innocent, like that. So the humor. If you want to enjoy immunoglobulin A, immunoglobulin A level, very important. That will protect you from the respiratory infections as well as the gut infections, the diarrhea, infectious diarrhea also you won't get. So simple, cheap, no side effects, do this. Okay? So, Anita ji, is it okay to
Yes,
now?
sir.
Then in that
Yes,
case,
sir.
yeah, you
Sure.
give the vote
May
of
I go
thanks.
ahead with the vote of thanks? If there are no questions, may I go ahead with the vote of thanks? Thank you so much for a wonderful, very meaningful and thoughtful session from you. Really enjoyed the good sense of humor which you have, and thank you so much for sharing your valuable experiences with us. And kindly accept our gratitude on behalf of the Department of Psychology, the American College of Madurai, in association with the Yellow Pond Counseling Center, Pallikarne, Chennai, and the Deccan Positive Mental Health Practitioners Association friends. We will meet with yet another beautiful session tomorrow at the same time. Stay tuned, be happy, and have a wonderful and a peaceful evening, all of you. See you all tomorrow. Thank you, sir,
Okay.
once again. Thank you,
Okay.
everyone. Bye.
Okay, good night.
Thank you, sir.
Thank you, sir.